themselves because they probably have their typical thing that they do. Yes, I'll pass it over to the ladies. Thank you.
Good morning, everyone. My name is Aminos, and I think I know maybe a couple of faces in here. I used to work with OCAP, so I have come through when we were doing some training on ship back in the day. So yeah.
I usually repeat my voice until soon, but my name's Ingrid. I've been in the privacy sphere for, oh my gosh, since 1921. A long time ago. So welcome everyone, and I'm really looking forward to all we have to say. So, oh, I need glasses for this. So we respectfully acknowledge that we are gathered here in traditional territory of the Stoney Health and the First Nations. It includes obviously Bears Lodge, Finnegan, and Woodstone. So we honor the Treaty 7 Regime and their enduring role in Stoney Health as sovereign stewards of these mountains and foothills since time immemorial. So as we talk about privacy today, we want to ensure that we mention OCAP principles. We acknowledge that the right to govern information is an extension of the right to govern land. So we commit to moving forward in the spirit of Treaty 7, one of mutual respect, truth-telling, and meaningful partnership. Thank you. All right, so not your typical stars. Some people I know recognize this, right? Any hands? Anyone know what this is? Excellent. So, did you know that this is one of the greatest data breaches that ever happened in the galaxy? Okay, so we're here today. We want to not share a similar fate of the Death Star. We all know how that went, right? If only they had better hardware controls, they would have been less open to attacks. If only they had multi-factor authentication, the droids wouldn't have been able to plug right in and access all that data. They had a data breach, if only they had a data breach response plan, right? A better plan to avert a disaster. And had they only encrypted the plan to the Death Star, they would have been able to squash the rebellion and save the Empire from disaster. So they dropped the ball. They didn't see the need to run routine mitigation risks and all of that. They didn't do training like this. So if only they had done their due diligence, the outcome would have been a lot different. So here we are trying to avoid the weight of the Empire. So how do we do that? Well, surprise, surprise. Our learning objectives today are key concepts, definitions, because we think we know all the answers, but in all fairness, we talk privacy talk, and then everybody's like, huh? What you say? We want to go over the privacy principles because there's 10 privacy principles worldwide, of which 5 are really relevant to us. We had a few incidents and breaches, the real juicy stuff. The stuff that we see day to day, or even stuff that we see occasionally. And you know, it's really awesome stuff, but anyway, that's completely different. And then we have a few case studies that you get to play with us, whether you want to or not.
Right. So privacy does it all in all language. So we're going to start first with privacy. What is it? Can anybody just shout out the answers?
Or we can show them.
Confidentiality.
Confidentiality. Great. Anything else? Respect. Sorry, did I hear safety? Perfect.
Now what about your right? It's also your right to privacy. You have, I don't even. Can you guys hear her? People say I have a voice that'll chill soup, and I know they're right.
Can you guys hear at the back?
Okay, well, okay, I'll get it. So what about your right? Your right to privacy. You have a right to be protected, and your privacy is protected as well.
Okay, so when anybody is coming into the health center, they have a right to know that when they're coming in, their information is going to be protected, kept confidential.
So why is it important to talk about privacy?
That's the law.
It's perfect. Yeah. Yeah. So it's the law, and it's also a matter of trust, right? How many of you are from the nation? Okay, that's yeah. So especially for you guys kind of have a tougher job because you have personal relationships within the community, but you're also serving the community. So it's really important that you kind of walk that fine line. So any information that you come into contact with, you need to make sure, like, because of your job, you need to keep it confidential, right? So there is the example, obviously, like you see people in community, right? Let your client or person that you've seen at their health center say hello to you first. Don't make that assumption that they want to talk to you because you know that through your job. Right? So that's an extra extension of that protection. Okay? Or the world, sorry. Yeah. So one of the ways that we control the risk to having a breach or an incident is how we mitigate it. How we mitigate it is through policies. Yeah. It's our favorite thing. We're privacy nerds, and this is why.
But yeah, policy sort of govern how we do business. So you will see time and time again that we have policies in place, and we have them in place for a reason, not just to satisfy the privacy commissioner and meet the law, but because that is giving us guidance on how we should conduct our day-to-day business. So I assume everybody has read the policies back to that. No, at least last. Maybe read the table of contents. Anyway, we'll go into some of the things and the rationale behind why we should know roughly what our policies are and how we should be doing business.
So the first terms are confidential information and personal information.
So what is confidentiality? Well, us as affiliates or custodians in our own right need to protect the information that's been entrusted to us. That's a given. But it also means that we're going to maintain the secrecy, as well as not to wrongfully misuse or disclose, which is, the truth be told, one of the biggest areas that breaches the confidentiality, because you can't help yourself sometimes. Or, oh, did you hear this? I heard Betsy's pregnant, and you found that out, let's say, from work. But you have no right to disclose that information outside of your job.
And the opposite is also true on that, because you might come to information because of your personal relationships or through Facebook. And we've had health centers where somebody posted something on Facebook. That person went and told the nurse in charge, saying that, look, this person needs A, B, and C. The nurse thought that this information would come because this client had reached out to the health center, but truth be told, the person found out from Facebook. So the client wasn't happy. So again, just be careful where you're collecting your information from. True story. So what is personal information? Just, there's no wrong answers. No wrong answers. Your address, thank you. Birthday. So personal information can be a myriad of things, right? It can be your name, a nickname, it can be a physical descriptor. It's anything that can help identify a person. So just be very mindful when you are sharing information that, just can somebody be identified off of that information? Okay, so always keep that in the back of your mind.
And that includes employee information, people that work at the center. Everything else, that's also personal information. Or how you're doing at your job. That is between you and HR, let's say, but it's not between you and the community. Unless you disclose it. So the way I always look at personal information is it's my story to share. If I want to disclose it, I can disclose it, but others should not be disclosing my information on my behalf. So I know it's my favorite. So what is security? That's the easiest one of all.
No protection.
Yeah, and IT is one of you have access, let's say, to electronic medical records. You have access to the center. You have all this information at your fingertips. But here's not the joke, but kind of the joke is that privacy is the key. And what did we do? We gave you all access to the EMR. We gave you all access to the files. We gave you access to a treasure trove of information. So yes, we've got our security all nice and locked down. It's been verified, certified, but we can't enforce ethical behaviors. So yes, you have the key, but that doesn't mean abuse the rights that you have been given.
So what is it that we do with information? So this is our favorite. Well, the collection use disclosure. Yeah.
But I almost flip it. So I do collection, use, disclose, and dispose. Storage is so it's cut. Chew your cut, regurgitate that. That's always how I remember cut. So when we have any information, whether it's health or personal, how do we interact with it? Are we collecting information? And if we're collecting, are we over collecting? Are we getting everything but the kitchen sink? And patients tend to overshare. It's just they trust you, they come in, and often you get an overshare. But the thing is, don't record the overshare. Record what you need to know to do your job, or the information that's required to treat a patient.
And the way we protect the information that is in our custody is through safeguards. So there are a number of different safeguards. There's administrative, physical, and technical.
You're apt to remember that. APT, easy.
So the administrative are things like this, like literally us sitting here, we're ticking off one of the safeguards. We're all learning about privacy. We're talking about privacy. Excited, very excited. Yeah, privacy nerds.
Exactly.
So yeah, just having your policies and procedures, making sure people are aware of the policies and procedures, right? Also confidentiality, everyone signs an oath of confidentiality if they start their work. Yeah, that's good. And if you don't remember signing it, maybe it's meant to re-sign things. And then again, the training.
Yeah. So it's the paperwork. That's how we look at it. And same as physical safeguards. It's what's physically look around you. That's physical safeguards. If you've got things like your filing cabinets are open, or you've got a desk that has all the health information anybody could want, whether it be cleaners, which is our example, or even just people coming in and they see all this health information or all this personal information strewn across your desk, because like me here, don't put the papers agree. So do as I say, not as I do. But maybe it's one of the biggest areas because it's untraceable. So if you leave data or information sitting on your desk, we have no way of knowing if someone looked at it. And let's say it's out into the community and you were the only one that knew, you would be the first one they come to. How can you explain, oh, I might have left it? So basically, your physical security, locking the doors, making sure things are done with my clean desk policy. That's do as I say. Obviously, the difference might look like it was asked of someone. I have nothing private in there, just my financial.
And then the last one is technical safeguards. So making sure, again, you guys have a good IT team that looks after the computer access on the network. But then you also have to do your part, right? With emails and managing and making sure that you are not opening things that are questionable. And again, we'll talk about that a little later here. And then also with your EMRs and your Nectar accesses, if you have them, lock all, never keep things open.
Because it's recorded under you. So in our days when we were running the Nectar team, that was so much fun. Everybody, we had many instances where somebody would leave their computer open, someone else would go in. And then the person when we blamed them, they're like, oh, I didn't do that. I was at lunch. I was whatever. But their screen was open and someone went in and actually used their ID to do a little bit of searching on whether it's their family, friends. So again, it's under your identification. So that's why it's so critical to lock that screen when you walk with them. And that's my favorite once again, because that's so listening.
And then the next one here is consent and notice.
So when people are sharing information, you should have their consent, right? In order to collect and use that information. So somebody walking into the health center is not necessarily always going to sign off on that, but you need to give them notice. So if you walk into the health center, again, I haven't done that in a while, so I don't know if it's still there. But I walk through a pharmacy, hospital, you'll always see a sign that tells you that they are going to collect your information, and it's under the Health Information Act. It's this section of it, and it just is letting you know that that's what's going to help.
Yeah, so your notice is your back. It's the same as you may see video cameras. You'll see a notice saying we are recording. They are mandated to give notice, same as we are. So we give notice because it's obvious sometimes why people are coming in. So we don't always get consent, but we cover our back end by having notice.
So the other concept here is survey care. So this is where that whole need to know comes into play, right? The people that information is shared for is what we call the circle of care. They have a need to know in order to provide the service to our clients. So again, just keeping that in mind anytime information is exchanged. Am I part of the circle of care? Somebody's sharing something with me. If you're not, step back and be like, I don't need to know this.
Yeah, and there's conditions. I mean, obviously, sometimes administration may need to know, but generally speaking, no. Administration may not need to know you're providing services to a certain individual, and they may be asking out of curiosity, but we don't have the right to disclose that information unless we have either a consent or validation that that is an allowable exchange. And it's on the slide that you'll like, that's I assume. And if you need to know what sections to look at, we're called the privacy officer.
Cybersecurity. So basically, cybersecurity is all things to do with our technology, I guess. So password, email, remote access, all of that stuff is included in that. And the reason we're so worried about it is because of social engineering, right? People are always trying to get our information. Information equals money.
Yeah, truly. So that's a wolf in sheep's clothing. Wolf is cut off, but that's okay. Anyway, so the biggest thing is with the social engineering, and some come in and mimic or impersonate you. They try to get, guess what? Money is almost always the root of all of them, but there's also a reason many of these figure out. And the bottom line is they send out thousands every day, and it's like a shotgun that just splatters them in the hopes that they get some. And what happens is usually, generally speaking, somebody will wait. Now, seniors are notorious for this. My mother has been hit at least 2 or 3 times because she thinks, oh, what a nice person. You're offering to come help me. No, there's no one coming to help you. They're coming to get your money. And time again, she has actually, oh, yes, dear, of course, you load into my computer. Go ahead. Oh, nice young man. Well, that'll be $748 instead. Oh, we have to give her credit card number. Gives him access to her computer, all the passwords, because he needed it to know her. And when that looks here he was. And then it took her 2 or 3 days even to tell me, because she says, I think you're motivating this number. Well, no shit, Sherlock. Like, yeah, thanks, Mom. I'm waiting to wait to tell you. I want over this. Like, stay off the computer. But she's 91. If I tell her to stay off, she'll move harder. So I can't teach her anything. Anyways, it happened twice. And I'm still fixing all her attempts.
Hospitals was racing, right?
I know.
Anyways, her mother's just giving her something else to do.
Yeah.
So we mentioned the whole idea of phishing. So that wide net is cast, hoping somebody will click on it. And then there is secure phishing, which is very targeted. So I had an example where my boss messaged me for a phone number. Very random. We looked at the email initially and it was like, oh, that's him. And lo and behold, when I hit on it a little bit more, the name part was not the same. So, and she's done the card fraud.
Yes.
To her.
And I almost went down the path, but my coach, the Olympic team on the side, because I had nothing better to do with my life. And the boss from there sends me, he said, I need you to pick up these gift cards. I'm like, oh my God, what a water, because like, let me volunteer. I'm like, this is going to help me get further ahead in life. Dumbass. Anyway, so what do? I go out again, buy the gift cards. Just a minute. Why would he be contacting me? He's got staff that actually do it for him. And like it was a moment that I went behind and center for my own thing. I teach what I want to do. What do I do? Anyways, I used to get hurt myself. I just deleted that email, ran like 80 double two bricks and said, like, how stupid could I be? But yes, I was.
It happens. It happens for all of us.
Just like,
Yeah. So, and the way I find a lot of information on you is through what's out there, right? On the net, social media is a huge one. So be mindful, right? Of what we're putting out.
yeah, especially, and I hate that my mom is the worst, but like Facebook, as an example, Facebook all the time has all sorts of information about you. Like I can't speak for everyone, but like my mother has on there, oh, my children, and she named all 4 kids. Oh, and I did this and I did that. Like, oh, I'm going to Europe. No, like stop. But everything is on there, and a lot of people use their passwords. So my dog Betsy ran away yesterday. Guess what they did? Oh, Betsy 1 2 3 will be a password. Everybody ends with an exclamation mark, or not everybody, but most people, so they can guess those passwords based on Facebook. So please be careful with that, how much information you post on Facebook. Sorry about that. And social engineering red flags. So this sort of picture is to help you what to look for. So the biggest thing is where it's from. As soon as I get an email that I'm like, feels a little funny, I automatically go over the front, hover over it with my mouse, and if it says Russia.org or UK. Then right away I delete it, because you guarantee that's not someone you know, but that's almost always the best way to find if it's a scam. The second thing is when you look at things like, oh my gosh, I need $1,000 or Sonny Boy's in jail, or, any of that, there's a sense of urgency and a sense of panic. Then that's a huge flag. The other flags are things like if you see in there spelling mistakes, because don't forget you're sending out thousands a day. So please be very cognizant of those things, because, don't get hooked. Delete it.
And just be really careful of just not clicking on anything. Can't stress that enough. If there's ever anything you get to your work emails, reach out to your IT team. Don't delete it right away, just reach out to your IT team.
Yeah, exactly, because an example would be my mom. She's got enough of war example. She keeps wanting to come so she can deny it. But she's truly not a good person, not good at this game. So she clicks on because she got a flash at glance, and it said, you will be billed on your credit card X amount for your subscription to Clash of Clans. She went up and smoked, of course, because well, the apple was a nice small apple, wasn't the product or the apple, I can't remember, but anyway, we're having who knows. And either which way, what does she do? She clicks on it because that wasn't true. I'm like, again. So cleaning that up, because as soon as they've got a target moving, and then they're following her, and then they're following up, or because she gives away everything but the kitchen sink. So just as if it is somebody you know or is somebody you want, they will call and say, I sent you an email. Then you can say, could you please resend it so I can follow up?
So just reiterating, just do not open up things. Do not provide any financial information. Learn the hard way. And delete things from your inbox and your trash folders when they are official. You know that they are. And then just don't click on any links.
Oh, thank you. Did you see it get bigger? Because it did on my screen, because you know. Anyway, your glasses come with different moves. So, workstation security. This is the easiest thing. This is what I call all of you a human firewall. Because these are things you can do to prevent breaches or incidents from coming into place. So use complex passwords. I shouldn't tell you mine, but mine is easy. It's easy, but it's complex because what I do. So I had my husband's initials and a hand sign and then they faxed me and then I did a little lot because I'm like, you know, because I thought it's a phrase I will remember, but it's also something that's got so many symbols and up and down and lowercase and uppercase that nobody will ever guess it. Now, does he really love the cat? I don't know, but either way, I still need it. But those are kind of things to have. So with passwords, it's just easier to have a catchphrase so that you can remember it. It's less important to change every 90 days than it is to have a long and strong password, because that long and strong will actually save you because it's so much harder to have.
And also making sure that you're employing multi-factor authentication on all of your apps.
Especially if you're in an airport or hotel. And the other little things, like be very cognizant, like changing your password is one thing. Don't write it down on a sticky note. Please. Because you know how many times I've come into a hospital or a clinic and there's this nice sticky note with the password.
Or you think it's hidden underneath the keyboard or the mouse pad.
And I
Send them all.
had one that had it in a notebook, and they were passwords to everything there, Eva's there. I was trying to remember, but it was in page 1 of the notebook when you open it. And I'm like, ew, that's here. I should have used a few in fact. No, I'm just kidding.
And then the other thing is obviously Wi-Fi networks, just making sure we're being diligent and careful when we are outside of the workspace where it's not a secure network. People tend to go into Tim Hortons, wherever, and just, log on to the Wi-Fi and do whatever they need to do. So there was an example at the Starbucks, and they were just trying to point and I guess trying to make people realize how susceptible those networks are. So what would happen is as the person was in line, they placed their order. While their order is being prepared, the hackers are in a van outside, plugging into that person's phone. So if they're in their banking app, guess what? All of a sudden now their balance is visible. They were putting personal information that was off of their phone onto the order. When the person got their order, there was things that they shouldn't know. And again, it's just to prove a point that most actors are malicious when they're trying to do that, not just educate.
Yeah, so Starbucks Wi-Fi is not secure. Thanks, Alice. I know you know all that, but it's true. So please be cautious. If you need to, try not to access work information. If you want to give up your banking information, I know that. But please be very cognizant that work information should be protected more so than your personal. Because your personal, that's your choice.
And sometimes it's difficult when we're like in hotels and stuff like that for work and you need to do some work. So again, getting in a VPN. So I don't know how many of you have VPNs on your work laptops. There you go. Everyone that has, yeah, so there's a few hands that went up. Everyone has it. And it should be activated at all times.
Yeah. When you're around us.
When you're And then when we're sharing information, making sure that we are encrypting data. Can't stress that enough. There have been a number of breaches where laptops have been stolen and the information was not encrypted.
Yeah, and then the other thing is the favorite thing about USB sticks. Many organizations, including this one, don't allow a USB stick to be put into their system. Do not use them or try not to because you collect them.
Well, and my dad is around when he used to work with the parking authority in Calgary. He would collect them for me many years ago. And he would be like, you should use this. But little did I know then about the information while they're being so valuable. I could have been rich. It should have been sitting on an island, sipping some lovely drinks. Drink more.
So the reason this is important is because laptops are stolen frequently. So there's one every 53 seconds. And guess what? 97% are not recovered. obviously. Like, I've seen them left behind on planes or in coffee, or somebody goes up for a coffee and the laptop, they turn around and it's gone. We had many centers, quite a large organization. The IT gentleman was working on a whole bunch of data to develop a new system, and he had it in the front of his pickup. Wonderful. Stopped at the bar for a soda pop or two, and his laptop was stolen. It was a smash and grab. Well, on it was thousands of medical files. And what happened? They kept it secret. One of them together. So actually, that's what triggered the mandatory breach reporting and everything else. Because by the time the commissioner and the privacy officer, or the minister, found out, of course, it was way too late. So what ended up happening is, here we go, case in point. I mean, that information is valuable, and patients were contacted, and that's how the minister found out, and that's how the commissioner found out. So again, if there's a breach, it's reportable, but please protect your laptop, or at least have multiple authentication layers on.
Privacy principles in Alberta's privacy legislation. So before we actually get into that, I just wanted to kind of touch on OCAP. How many of you have heard of OCAP? Okay.
All right, so the OCAP principles are of ownership, control, access, and possession, because that information belongs to the First Nation. It doesn't belong to Alberta Health or everyone else. So there's rules and regulations around it, and the bottom line is we control our own information.
And the framework was developed mainly because in the past, research was done about a nation. It wasn't ever done for a nation. So it wanted to make sure that we were changing things from the nation being subjects to being leads, right? So just like a nation has the right to govern their land and water, again, you have the right to govern the information that defines your people. Yeah, so information is power, and for too long, First Nations data has been collected about you guys and not by you. So it's just that shift. Oh, sorry. But again, because we are a health center, we have to work with cooperation with the province, and make sure that we are looking at the legislation. So OCAP looks at things from a community perspective. It looks at data on that level, whereas the privacy legislation looks at the individual.
So that's really the biggest distinction. And also there is some that, like aggregate data, that's allowable to go up because of course there's no identifying information, and it's required for certain purposes like statistical, or if there's an outbreak, they want to make sure it's controlled and managed. And that's why that information in an aggregate level only can go up, but not individually identifying health information that belongs to, or community information belongs to you.
All right, so privacy principles. So again, I think at the beginning you mentioned that there were 10 privacy principles. These are the 5 most, I think, important pieces.
So the easiest is least amount of information, right? You don't overshare. That's good. To me, that's logical. So if you are collecting information or you're using information, for example, a podiatrist doesn't need to know that you had a worm removed from your shoulder in 2000. They don't need to know any of that, but what they would need to know is medication that may affect your feet, the swelling, or diabetic instances. So make sure that what you're sharing is relevant to who needs to know. Which leads to need to know. I know, I was walking into that one. So if people don't need to know, please don't share it. So the need to know basis, again, podiatrist, wonderful example. We're finding lately that dentists are one of our biggest offenders because they think that information, well, of course we should share it. Well, they just want to be important. I'm just being a personal dentist here.
Very good. And then, of course, the highest level of anonymity. So where we can protect someone, we should always try. Again, remember the whole idea of identifiable information, right? Being personal. So we try as much as we can to protect the person. And that's it. As long as we've given it a reasonable effort, we've done our job. Legal authority. So again, regulated health professionals in here. Lots of them, yeah. Okay, so for you guys, you need to make sure you're working within the legal frameworks, right, that are set out by province, in terms of the Health Information Act, and all of that. And then, of course, the consent or notification, which we've kind of already discussed, but again, that is a basic principle. And all legislation is based off of those 10 principles.
So our favorite is the legislation. This is where everybody can know quick now. No, I'm just kidding. So they're CORA. What a name. Anyway, they should have been more original names. So Protection of Privacy Act is relevant to government. So we will rarely be affected by that. Same as the Access to Information Act, ATIA. Again, this means, anyway, better than the effort of FOIP. This replaces FOIP. So if you've ever heard of FOIP, I'm going to be FOIPed, or I'm FOIPing you to get my records. Doesn't apply. Nice try, swing and a miss. If they're asking for that, it comes under Health Information Act or HIPAA, Personal Information Protection Act. That's the only way people can ask for information about themselves. So why we're on here today is basically because the Health Information Act mandates this. Mandates regular training, regular understanding, and of course the consents, the usual. But the Health Information Act is the strongest legislation, and literally in Canada at this point, HIA is the strongest legislation, way outranks, Ontario's PHIPAA. That's another bad name. Or, Nova Scotia's, like they're all trying to catch up to Alberta. So for years I cussed out Alberta for being so rigid and strong, but on hindsight, I'm okay with it now. We recently had an update because this was 2001. Is when it was brought into, and as we know, computers were hardly started then. And there was a lot they never envisioned really full electronic medical records. So as of August of 2025, they actually refreshed it. Now it's only about 4 years ago.
So the HIA basically assigns everyone a role to play when it comes to privacy and protecting information. So who is the custodian of health information? Does everybody know? Do you guys want to identify yourselves? Yeah. So there's our custodians. Affiliate. Everyone in this room is deemed an affiliate. Okay? Our privacy officer, who's that?
I see you.
So right there, Suzanne. Okay. Then Sterling and Anne, right? That are all custodians. So it's good for you guys to know who you go to when there is any questions on privacy, when there is an incident or a breach. And then your information manager is the person that holds your information for you. So your electronic medical records, that's who that is. And great to know. So
Protecting our patients. So 5 golden rules, right? So guess what? The custodian is the ultimate responsibility. So if one of you does something wrong, the custodian will have to answer to it. And then the custodian, on the other hand, gets a ticket out by saying they were all trained. They all read the policies and procedures. And then that is, I don't want to say they're taken out, but then the onus falls back to you as an affiliate to say, oh, well, I did it because of this. Or, now if it's malicious in nature, just get in mind. Because if it's malicious in nature, is when the commissioner cares more than if it was accidental, or if you took reasonable effort to protect, then they're pretty happy with that.
the need to know, so again, just protecting our neighbors, right? And our relatives from unnecessary gossip. So it's really important. Again, how would you want your own information to be handled? Kind of, that's always a good question to ask when we are sharing things. Get highest level of anonymity, we kind of discussed that, the right to correction. So if there is something that is wrong within the record, the HIA allows for a correction, right? So we just always want to make sure that records are accurate. And then of course our circle of care, right? Making sure that we need to know.
And it stays within the circle of care.
And again, doing that also ensures that people have that trust with the health center. They know that they can come in, seek services, and their information is going to be protected.
Well, we're going to our favorite part, my favorite part, because I'm always amazed that people do things, just saying it out loud. So what is a privacy breach?
So breach occurs when somebody has information that is either stolen, lost, or looked at by somebody that doesn't have the need to know. Okay, it's pretty simple. What do we do when that happens? Right?
Yes, contain it.
Stop it at its source. So if you got a questionable email and you clicked on something, and is it unplug it?
Unplug it, that's my little pull the plug right away so everything stops. So that's what we do by containing the breach, or let's say it's, electronic is the easiest to use. But let's say you see a box of files that went into the dump, like retrieve it, put it in a locked thing and report it to the privacy officer. Like contain it, don't let it happen. Say, we'll wait till it flies around the neighborhood, which has happened. So that's what we mean by contain the breach.
Step 2, evaluate the risks, right? So who's seen it? What kind of information was it? Take those steps and figure out, okay, what do we need to do next, right?
Yeah, and it's like evaluating to see, let's say there's one patient and you were able to retrieve the information, then that's a low risk of harm. But if you've got a whole patient list that went out with all sorts of identifying information, let's say it's cancer patients of such and such a date, and it lists all their names and addresses and information, that then becomes a bigger risk of harm. A, sensitive information, obviously. B, lots of personal information and quantity of people, and sometimes that's not able to come back. So if Google was crawled, let's say, and that information is now in the Google fold, let's call it, and Google never holds anything that's publicly broadcasted. But if it's been crawled, then that access to that patient information is now in their hands. And as soon as it gets to the dark web, guess what? $1,000 a patient file. So if anybody wants a side job, I'm totally kidding. We'll do that. But it's worth $1,000, whereas a credit card is $5, right? It's one and done. So that's why health information is we're so paranoid about making sure we're protecting it. And then, of course, notification reporting. As soon as you report to the privacy officer, she will have actual steps to follow. And then, of course, prevention. So we then put in policies or make sure there's a way to prevent that from occurring again.
Just tighten up those safeguards.
Well, this is, again, we don't want to breach. Do you know why? Because it's a nightmare. For free, I can tell you it's a nightmare. So if there's a breach resulting in harm, then we have 2 steps. If there's no breach of harm, great, we don't need to report. But if there is, then we have to go to the next step and say, who did we make the disclosure to? Was it the newspaper? Hopefully not. Was it something like, well, you probably don't even print newspapers anymore, but anyway. But if it was made to another custodian or an affiliate or a dentist or a psychiatrist, it doesn't matter, somebody that's also under the Health Information Act, we're almost saved by that, because then we can go to that custodian who has an obligation to protect health information. So then we discover that, yes, that's sent to the custodian, we don't need to report. But if not, then we have to go to another step. And then we have to determine if the information was secured. Were we able to get it back? Were we able to retrieve it? Were we able to stop the stem of the flow of the information? And if that's yes, then we don't need to notify. We do need to keep reporting it, but we don't need to notify. And then there's things like if it's a no again, it wasn't secured, then we have to determine the probability of misuse. So if it's been crawled by Google crawl, if it's been taken by Google, then there's a high probability that it's in the dark web. If it's something like a box of files, it's a high probability because of quantity, because we don't know where they are, we aren't able to retrieve it. So that's all determined. If we're lucky and say there's a very low probability and it scores 1 out of 10, then you know what? We don't need to report. But otherwise, mandatory breach reporting. And the paperwork is about 30 pages long, plus all the files, plus a 2 to 5 year investigation. So please don't forget. That's the moral of the story.
Okay, now we're gonna just kind of take a little bit of a breather here and we're gonna do some group work. Are the case studies? Okay. So we're gonna have a number of case studies where we're gonna pass around here. And I want you guys to take the time to kind of look at them and think about it in terms of this breach reporting, but also this first step. Okay, so one hand out, we'll just kind of take it through.
You're gonna pass through.
Is everybody done or do you need a couple more minutes? Okay, I'm gonna take that as everyone is ready to go. Wendy, are you guys good? Yeah, okay, so who has case study 1? Okay, so Wendy, you stay right here. Who has case study 1? Oh, okay. Okay, I know you have it over there, and so do we. So there's 3 tables, I think, that have case study 1. You guys want to share maybe the first part, what your guys' thought was, and then move to another table? Tell us. Oh, just read it. Shall I read it? Okay, I'll read this story. So this case study is called the community gossip breach. So the scenario is a community health representative at the nation's health center was also a well-known community member, a well-known member of the community. While visiting a local outlet for a social visit, the community health representative mentioned that a younger community member had recently been seen at the clinic for substance use counseling. This information was later shared among other families in the nation. So, we spent a lot of time, I think, discussing our second needs, just for a small group, but yeah, we talked about how this scenario can come up a lot with obviously our community members working at the health center as well, and home visits, social visits.
Can we tell what we're talking about?
Yeah.
Oh. We discussed that when the CHR went to the elder,
It doesn't say whether the younger community member had went to the CHR to seek help of an elder for ceremony or much for their addictions. And the CHR did not have no need to be acting as that. I've been in that scenario. I don't name, say name until I get the okay from the young community member who connected with bipolar. All that is done later when everything is set up. So no need to be functioning at that point. I think that's what we need to know. So, yeah, I think your health will be discussed.
I think the first part of the question was, what are there 4 steps? Does anyone want to tackle that?
How would you respond to this reach? When we talk about how, especially in small communities, we can't really obtain that information. It's already out there, so we don't know how to. Yeah, I don't know how to study for that. As for risk assessments, I believe that's what we're going to have to assess what type of information was on the page, how it was an individual, and so on. And as for notification, we would have to contact the client. And for prevention, we can prevent this. As for recovery, that's going to take, I think we try just for recovery to get more, I guess, trust. We don't trust with the community after they kind of reach. So that's the little step that we have here, about those 4 steps.
Do you guys want to answer what type of reach this was? Okay, we also, we had discussed that it was an unauthorized, we're speaking by studying unauthorized disclosure. And the last part was severity of the risk. Was that this is a high sensitive because it was mental health implications, but the information is disclosed.
Yeah. So there's a couple things too. You are correct. That was not mentioned, but if the individual wanted to report, sorry, okay, yeah, you don't need other issues. But you are correct. If the individual wanted to be speaking to an elder, make sure we obtain consent. And then absolutely, and then connect the two. Because again, it's their story to share, and we don't want to see their organization. It is a high severity because of age sensitivity, and the elder is not in a certain step. So all those things are contributing to caution. We are health professionals, we keep the information to ourselves unless the patient specifically said, I need to go over an elder, could you do this? And then we make sure we have consent.
That was great. Okay, number 2.
From the shot.
Number 2, beginning of the people, it's something that's okay. So we're going to be studying into, I don't think it should be studied, it's up on the screen. But essentially it is the release of information
sent an unencrypted personal email. It was the wrong individual's information going to the right provider. So, step one continued, like we just said, contact the city, and they were a trusted partner. So we can pull that information back. Obviously, check the email, take a call the email as quickly as you recognize it as an error. That's the first thing we do, or try to do. Step two is risk assessment. We had a little bit of debate on this, whether it's a medium or whether it's a high risk, just because the type of information that was released, the fact that it went to a personal email or came from a personal email, we weren't sure, so does that make it more public than to an external person as opposed to a trusted partner? What's that going to tell me? And notification will not be conventional program, but to notify the province of any issues so that people would have the signature. And then we didn't get as far as forward, but we did discuss what type of issue was, and we said it was definitely unauthorized access. We questioned whether the information to one client and what other information should even have been available. So we would have done the turnaround and back to that to do some investigation to be sure. Unauthorized disclosure. And oh yes, and there's also digital reach because it wasn't an encrypted email. And it was the question whether it was coming from an encrypted email or whether it was going to the assignment. So that's it. Yeah.
That's the privacy information. That's number 3. Don't be shy. Does no one have 3? Don't make this painful. Okay, can we move on? Or do you want to do pilots? Okay, number 4. Who's speaking about our step?
Okay, so step 1, they were going to go for records out of the room and look at somewhere they were secure. And speak to the person who did go into the box. Notification of notify the privacy officer. Prevention and recovery would be redirect the info and notify the people involved.
And no vendor was visited in the process of that.
So there's some people buy health plans. So that again, it's that right, it's not information because he's not the custodian of that information. So I always tell people when they ask, like, go to my health records, your health records often is posted at the same time in the real-time integration with data. So that information's already there in your file. And I feel nice as soon as I get any fun. So I have my excuses ready for the call. Okay, I had an extra silver. But anyway, great. So that is very good information. And it also means you're more proactive looking at your health plan. So if you would have it looked up, my health records, it's the Alberta repository for every patient, or every Alberta. Yes, I have to agree with you.
Oh yeah, the night is raining and skiing. Child.
This is what I do. No, it's gonna be. Okay. No, it's gonna make people laugh when it comes here. I'm gonna use it as a salt shaker. So, Stella, give me the opportunity. She's a big boss man. She doesn't like that name, but I'm letting her do it. Okay, go ahead.
Gee, thanks for sharing.
It's like Stella the way you go here.
You have no idea. Okay, do I have to share what the scenario is first?
It's awful.
Okay, all right. So for us, we felt it was a bit of a physical breach, low to medium risk. For containment, we felt that because it was reported immediately, as far as we can tell, that retrieval of the files for proper custody and either storage or disposal. Then, as far as risk assessment, investigation into who may have had access to the space while it was empty, and if there's a possibility that somebody else has access that we were even prior to that. Also, maybe looking at how old the files are, if there's that requirement to ensure they go back to the clinic. As far as notification, having to contact the impacted individuals, so whoever's files are in there, notifying them with the information that their files may have been accessed. And then as far as prevention and recovery, so again, ensuring all files are recovered and either properly stored or disposed of. And then creating a process or policy for going forward that requires offices to do inspections and audits of buildings when vacating and having a consistent process for going payment files. Terry, did you get number 7?
Oh, Terry's blocking number 13. Who has number 7? And number 8, you're on deck. Okay.
Okay, what's up, everybody? My name is Matt Manninga. If you don't know me, outreach worker, we got the youth program. We got the juiciest one, the Family Feud. So a pharmacy technician was going through a contentious divorce. She used her access to the pharmacy dispensing software to check if her ex-husband's new partner was picking up any specific medications such as antidepressants or birth control to use as leverage in the custody battle. Now, step 1 is containment, which we would revoke her Alberta Medicare access. Rashay, you want to give a visual of what that looks like? So any healthcare provider has this type of swap. You have access to all the healthcare information, so we will revoke that. And then step 2 is risk assessment. That's highly sensitive. It's higher risk because it's sensitive info, and it deals with mental health, sharing with the public or community members. And then step 3 notification is provide this information to the privacy officer. And step 4, prevention recovery. Our team decided to fire her ass. I'm just kidding. I was kidding. No, like more training, just like we're doing, we're all doing here. And also maybe suspension what we needed. And that's basically the thing. Oh yeah, there was an unauthorized access breach and digital. So, thank you.
He does not need a mic. Sorry.
I have a question regarding the legal implications of a backstory. When that happens, the individual can hear the individual turn around and sue the person that did the wrong back or the whole thing. Doesn't matter.
Well, sue's a bit of a, and you can't sue, people here don't tend to sue as much, but they do, they also. So they can report it to the commissioner. The commissioner can't take punitive action, get the person fired and all of that. But the tendency of most Canadians is not to sue. Could they? Yes, they could. But yeah, mental harm, yeah, of course. Yeah, and you're entitled to it. Yeah. Yeah. No, you're correct. Okay. 9 and 10, you're on deck. 9? You guys are done? Okay, so these are the non-food. You can share, you give your thoughts on it.
Okay, so our case study was the ransomware lockdown. It involved a large physical therapy clinic that was hit by these ransomware attacks. The hackers encrypted the clinic's entire database, making the patient's charts and schedules inaccessible. So even though they agreed in advance, the clinic could no longer provide care because they didn't know the patient's life histories and treatment plans. So our steps that we would take in this happening in our facility would be step 1, we would shut down the power and air. So for example, have to the safe chart immediately. And we will containing it might be too late, but if we shut it down. Risk assessment, well, we can no longer provide care in that moment because everything is exposed. So critical data is exposed and lost. Notification, we would notify our safety manager immediately, IT, and possibly the safe chart system. Prevention and recovery. Definitely do give a safety training refresher, debrief of the incident, and also the emergency safety planning, maybe a code or make an announcement while this issue's going on, and to hopefully restore access to the lost files. The type of breach, we identify it as unauthorized access and digital. Severity is set high because it is a high sensitive unauthorized digital breach. You guys want to start or yeah, okay. Let's compare.
Well, we heard along the same thoughts of containment. We stopped everything. The Wi-Fi and providers, we prevent information from coming in and going out. It's might be just like a stopgap measure, but it's something to prevent any more information from being leaked. We saw a risk assessment. It was a high risk assessment because it was high information, healthcare clinic, and a breach. As we identified it as basically all kinds of breaches aside from physical, because even though that was rare, that there's still a chance that the information would have been taken and sold, because you can't really trust what a hacker says that they will do. And we call the privacy officer and get in touch with possibly RCE because this is a ransomware attack. It's something small, so it has to be dealt with at a high risk level. And only when we have all those things in place, but we notify people that there was a ransomware attack, information privacy wasn't breached. Because if we could let everyone know right away, then there could be like online chaos that may cause even it becomes even more difficult to identify a problem if there's just like a lot of online traffic from some incidents. And mention of recovery with a privacy officer, get in touch with police who are here, listed unaware. The employer. And IT council and police to at least see if you can either get rid of this ransomware virus, and see if we can recover everything in the best case scenario, worst case scenario, see what we can do to mitigate damages on payments. So yeah, in terms of breach, I'd say everything but physical and privacy.
Oh, and then we'll contact the people who designed the program. And they know how to shut down the program. And then we have to reassess this and reprogram because the hackers already know the program and how to get in. So we probably have to shut down everything and
seek data info and do an investigation and recovery. Like I said before, we don't know if she disclosed this information to anybody else. So at this point, the type of breach would be unauthorized access, digital, physical station, computer station, I guess. So, and yeah, I think that's it. Right?
Yeah, you're right, yeah. And so, but these have all happened, sad but true. And the physio clinic shut down. In this case, yeah, she was fine. So all of these are real case scenarios. So guess what? Breaches are expensive. I'm sure you knew that already, but the minimum is 10K. And it goes up to 50K. But the good news, is that the last legislation introduced a huge increase. Now we're up to 100 or 200K individually. And I'm going to put a disclaimer on it. Accidental is one thing, but in that last case scenario, that was malicious. So she would have been charged and could have received a fine up to 200K. But worse yet, us as an organization, if we didn't provide training, if we didn't provide any of the information, us as an organization can be fined up to $1 million. And that's a lot of money.
All right, so obviously myth versus fact. So, again, these are kind of some of the takeaways that we can use as we leave here today. So myth, I'm related to the patient, so it's okay for me to look up their charts, their labs. Being family does not give you the right to access, right? That whole need to know. If you're not the person providing the care, you have no need to actually access that person's record. Again, like she said, use My Health.
Yeah, to look it up. Or this has happened numerous times. We find this happens lots in scenarios. I don't want to go into the ex-husband routine, but anyway. We have a lot of it for malicious purposes or curiosity, let's call it, and one of our scenarios shows an ex-lover actually accessed Medicare to keep a lookout for how soon his wife would die. Like sad but true. Or things like child custody, we often find it there. And then of course, just curiosity kills the cat. Some want to know what their aunt is up to or someone else. But that's not what this is designed for. It is not a tool for satisfying your curiosity.
The second myth is if a community member asks how an elder is doing, or anyone for that matter, it's not rude to tell them, like it's rude to not tell them, but okay, that's the myth. The fact is, again, kindness doesn't overrule consent. We do not have consent to share someone's information, so we should not share it. Again, that idea of that circle of care. If somebody is concerned for somebody, tell them, I don't know, I can't say, maybe you should reach out to them or their family member, right? There's ways to navigate around it.
And then privacy only matters for computer systems, let's say, or electronic medical or digital files. True or false? Well, the truth is, there's still paper records, believe it or not. Some of us older ones keep that. And then no matter what, the conversation and the follow-up, fax machines, all of that is at risk. So it matters for everything. Privacy is about everything, including the front reception, everywhere. Privacy matters.
Yeah, so if it can be seen or heard by someone not on the care team, it's a privacy risk.
That's what happens when the printing is so small. So prevention is the key. So the key takeaways are we can prevent it. It's a lot better than paying a fine. It's a lot better than doing a breach reporting. It's a lot better than figuring everything out. So collecting what you need to do your job, easy breezy cover girl. We can manage that. And then things like identity or mitigate privacy risk, stop it before it happens. Don't wait till after it happens and say, oh darn, a little late then. Things like proper security, your procedures like apt to remember, your administrative, physical, and technical safeguards. You know, encrypt. If you're sending out an email and there's not a secure mail option, then encrypt the file and make sure to get the patient consent, because email's a bit risky.
And when you're encrypting, do not send the password in the email or by email.
Blue Cross did that for a while.
Alberta Health still does that.
I know, it's, anyway. It was, yeah.
Anyway. Oops.
Yeah.
So yeah, I mean, the whole idea is that, right, we're not going to be perfect. We're all going to be, we're human. We're going to make mistakes from time to time. But the fact is that we are working together. It's a team effort. When there is a breach or an incident, make sure you go to your privacy officer and your custodians even of the health information, right? Nobody's alone when it comes to trying to do this. So today we've just begun the discussion on privacy. It's no way the end, so hopefully you guys will continue this discussion going forward as an organization. And if there are any questions, now is the time to ask.
We have lots of answers. Email 3 and 4. Oh, I was gonna jump. Okay. Might break something.
Well, we talk about personal information. Is a photo being considered personal information?
That's identifiable.
So sharing by email someone's photo could,
It is a breach.
it's a breach.
Yeah. Or an incident in this case.
Yeah.
Unless you have specific consent. You're gonna take the patient's consent, and then I will send inside effective email. But consent. Yeah, it's not. You're the share.
And it's a picture being shared because the person who is still in the camera, your profile, and us also.
Within the context of how it's being shared.
Yes. I did a patient that's going to see another provider, and they don't know how the patient looks like. And just make sure the patient is okay with that. As soon as they say yes, you can send it, when they print it, just print it out.
I work in communications, so I'm always putting things in newsletters. I was wondering what kind of parameters around what I can share or can share. Obviously, we're not going to share someone's picture of a woman, but, you know.
Yeah. But the other thing is, so a community event, if we have a notice on the Lord saying, please be aware in case people will be this being here in publication. Do we have their consent? If you have objections, let us know. As soon as they let you know, I don't want to be in there, then you make sure that their photo is smudged or blurred. There's a new word, smudged. And then you've met the requirements because you provided notice and they have told you no. And then you can move them.
For everyone else who doesn't come up to you and say they have a concern in that situation, is that implied consent then?
That's implied consent because you put up the notice. Oh, by the way, we're being.
Sorry, we are being filmed right now. Anyone else have any questions? Okay.
Lots of good stories if you want to know.
I wanted to thank everyone for sharing and participating in the case studies. I hope you all found that really valuable, and everyone want to thank us and Ingrid for coming out and sharing their expertise and their humor and their humanness with us. I think we'll take a brief break and then get back in 10 minutes. So there is still food at the back, some water, some juice, you can help yourself. There's bacon, just the bacon, so you can have some bacon. And yeah, 10 minutes, thank you.